Our next guest heads an 132-year-old company that's reinventing itself to meet the future of global healthcare while keeping a laser focus on the values that have led to its growth and success. To discuss the company's latest focus on the positive impact life purpose has on our health, please welcome Chairman and CEO of Johnson & Johnson, Alex Gorsky, with Fortune senior writer Erica Fry.
I love it when you go crazy. You take all my inhibitions. Baby, there's nothing holding me back. You take me places that tear up my reputation.
Hi, Alex. Thanks so much for being here.
Thank you.
So we're at the Global Forum, but I want to start in the U.S., where we spend far more than any other country on healthcare, but results or the health outcomes by many measures are not so great compared to other countries. So, you run the America's largest, broadest healthcare company. What can we do to fix that? How do we change the paradigm?
Sure. Well, first of all, just let me say what a pleasure it is to be here. I grew up in Michigan, so I kind of feel a bit akin to Canada, and used to spend time camping and canoeing up here all the time, so it's great to be back, especially before the winter really sets in. But Erica, you start with a pretty profound question, because you're right. Healthcare as a topic, there's few other topics that frankly are more important when you think about that it can make up almost 20%, about 18% of the US economy. And you consider when a patient undergoes a health event, it can be one of the most confusing times of their life. First of all, they're scared to death, literally. Number two, they barely can understand sometimes the communication that they're given from the practitioner. Number three, then they go to try to navigate through the reimbursement system. It can be really overwhelming. And so I think the key is, and we know that there are things clearly that we can do better to make it more effective and more efficient. At the same time, and look, I'm very fortunate. I get to travel around the world, see a lot of different healthcare systems. And there are lessons and learnings that we can take from all of them. But what I could also tell you is that in a time of need, particularly in specific areas, let's say like cardiovascular disease, oncology, there's no place in the world you'd rather be for some of those conditions and to be treated than in the US. So what do we do? And I think, one, it starts with better coordinating our system, getting it to talk to each other. Some of that can be facilitated through technology, but some of it needs to be encouraged, frankly, through the reimbursement systems, from moving on a per diem reimbursement basis to an episode of care, a more holistic approach to the way we think about reimbursement. In other cases, we just need to do a better job of, for example, coming up with ways to discuss end-of-life care and the significant amount of effort and resources versus, frankly, just very honest and transparent discussions about what potential outcomes could be had. And I'd say that another area is how do we keep people healthier in the first place? If we're challenged today, if we look at obesity rates right now among adolescent children in the US, and you look at the long-term implications of that, the more that we can do to be healthy, to actually prevent disease from occurring in the first place, those are all really important steps, I think, that we need to take.
Mm-hmm. And, drug prices are a big part of this. So I want to talk about that. J&J invests billions to innovate new medicines. Obviously, you need to get a return on that investment, but I think you'll find few people that think drug prices are, I think most people think drug prices are out of whack. Certainly, President Trump has made this a big issue, but has fallen a little bit lower on his agenda. So I'm curious, where do you think this is going? Is this an issue where industry needs to take the lead? What is J&J doing?
Absolutely. We are trying to take the lead and become an important part of this conversation. And look, I think here too, the good news is that in my 30 years that I've been fortunate enough to spend in this industry, I have never seen a time where the level of innovation with biology, with chemistry, with genomics has been richer and more exciting than what we're seeing today. I mean, literally to be able to be talking about cures of certain kind of cancer, we couldn't have even imagined that perhaps 7 or 10 years ago. Now the challenge is, of course, is how do we pay for that? How do we price it in a responsible manner? How do you develop a system that can be sustainable to support those kind of innovations that are coming in. And I think it's there where we're going to have to work together in different ways. You know, in the past, when you look at when a lot of our reimbursement systems were first put into place, you basically had penicillin or maybe some very rudimentary hypertensive medications. You know, today, people are staying alive because they're going to be in a lifetime of therapy versus some of these other conditions. And I think that's going to take all components of the systems working together to fundamentally change some of these systems. We're trying to work, for example, with CMS, with HMS, with other large payers and providers. And how can we get better transparency about how these products are being used, different payment mechanisms that are more outcomes-based versus just input-based. So I don't think there's any silver bullet. But I think it's going to take a combination. Those are certainly things that we're not only trying to work with this administration, but we're working with payers in Europe, and let alone other private payers to get a better outcome.
Okay, that all sounds like hard and sort of a long process. There was a report on Friday that the Trump administration was thinking about having drug makers include the price on their ads. So this is part of a way to lower the price of drugs. You know, what do you think of that? Do you think that would work at all?
Look, I think educated consumers and patients are in everyone's best interest. And transparency around pricing at all levels in the system is also a benefit. I think what we need to be aware of, however, is to not ultimately make things even more confusing. So it can sound rather simplistic to say, okay, well, let's put the price in a direct-to-consumer advertisement. So my next question would be, okay, well, what price do we talk about? Is it the list price? Is it the net price? Is it the price to the government? Is it a price to a particular payer? And I think making sure we do that in a thoughtful, responsible way, again, so that it leads to better informed decisions versus more complexity, is going to be really important. But in the end, we're strong advocates of greater transparency in the system so that, you know, all people who are utilizing it can ultimately make better decisions.
And J&J is, of course, much larger than a pharma company. You're also in the business of medical devices, consumer products like baby shampoo and Listerine. I reported on J&J a couple years ago. There were some critics on Wall Street that argued, you know, these businesses didn't have a lot to do with each other, and it would be better to break up the company. And you argued at the time that, you know, not only did the breadth provide some financial stability, but it was actually an advantage in sort of the changing healthcare landscape. So your stock has performed very well, but do you still feel that way? And, you know, why does that give you an edge in today's healthcare market?
Yeah, we are a believer in a diversified strategy, and, you know, as was mentioned earlier, I think one of the reasons we've been around and have been successful for over 130 years is because we are built on a model that can withstand the tests of time that any business is going to encounter when you're talking, you know, over decades of performance. And ultimately, we want to be able to seek out the best new treatments, the best new approaches in healthcare wherever they are. So that could be a new drug, that could be a new device. And I would submit to you that going forward, there are likely going to be combinations where we can either deliver a therapeutic locally, for example, an oncolytic agent through a device, or whether a device can provide long-term delivery of a particular medication. Think of something through a contact lens in the eye. And only by participating in those fields, and by the way, the consumer and behavior modification being tied in, having the ability to walk across those different areas to understand how clinical development and regulatory systems operate, we think is a clear advantage. And so it really starts with that belief around healthcare, but also whether it's our long-term financial performance and frankly, even the opportunity that it provides for our employees in terms of being operate across multiple domains, we think is a real source of strength.
And I'm curious, you do have all those businesses. Everyone's talking about how technology, big data, AI are going to revolutionize healthcare. And you also have all the big tech companies entering healthcare in one way or another. So how do you think about this new competition? Are you worried about it? And you know, you're a 132-year-old company. How are you innovating? How are you using these new technologies to keep up?
Well, we got to reinvent ourselves every day. I mean, we use that 132-year-old history as a source of pride, but we can't let it become an anchor. And I couldn't be more excited, frankly, about how this new technology that we would usually associate maybe with Silicon Valley, how it's going to be integrated into every aspect of healthcare. And I would submit that if you're not a healthcare technology company, it's going to be hard for you to be relevant. Let me give you a few examples. Drug discovery. You know, 50 years ago, drug discovery was largely an exercise in chemistry with some underlying biology. You know, more and more when you factor in the genome, when you factor in some of the new approaches we're talking, if you can't use large databases and do, you know, large computational exercises to those figures, your ability to be on the cutting edge is frankly just not going to be there. Surgery. You know, for years and years, surgery has basically been done, you know, pretty much the standard way, in a surgeon's hands, in an operating room. Think of it almost how we drive our cars. It was done in a pretty standard way for 100 years. Well, what are we finding now? Autonomous cars. Or even before that, if you get into your car today, if you drive a little bit to the left and you start to cross the line, you feel that little vibration, you move back over. Imagine surgical systems, digitized surgery, not just robotic surgery, but digitized surgery going forward that can help guide and better inform, you know, a surgeon as they're going through a particular procedure. Mm-hmm. And certainly in our consumer business, if we can't talk to consumers in new ways, utilizing different forms of communication, we just can't, again, do our job. So it's infiltrated, it's part and parcel to every aspect of our business. In building those skills, be it AI, be it machine learning, be it learning how to work with big data, it's absolutely critical for us.
Mm-hmm. I want to open it up to questions here soon, so be thinking. One thing I do want to talk to you about is purpose. You're a very purpose-driven company, and you've also been doing some work around purpose and its impact on health, and you've had some interesting findings. So can you tell us about that and what you're planning to do with it in terms of the business?
Sure. Well, you know, in addition to being a 132-year-old company, I'm incredibly fortunate that the founder of our company developed this philosophy about our credo 75 years ago. Actually, this is the 75th anniversary of our credo. And the son of our founder, General Robert Wood Johnson, who was basically on the eve of the company going public, was a bit paranoid that the company was going to lose its heart and soul when it went public. And so he wrote out this simple but pretty elegant document, a little over 300 words, that basically talked about our obligation to take care of patients, consumers, mothers and fathers that use our products, to take care of our employees, to take care of our communities, and if we did all those things, that the shareholders should get a fair return. And he owned 49% of the shares at that time, so he actually put himself last in that cascade. And so that sense of purpose has been with us for a long time. And I think today what we find is that it is as relevant now as it's ever been. And I think having a sense of purpose with our millennials, let alone the rest of our employee base, what we found through a lot of research contributes significantly to levels of engagement in the company, to levels of job satisfaction, to retention, to a lot of factors that ultimately make it become a self-fulfilling prophecy. And so it's something that's really alive and well today. And that, again, but we're fortunate to have that strong history at J&J.
Okay, and we have one question over here. Sorry.
My name is Nchacha Moloi from a company called Mujoli Resources. I am from South Africa. Now, for the whole morning that I've been here, I had very interesting terms like inclusive growth, like diversity. And when I look at these things like this, technology disruptions, whether it's AI, it's digitization, it's what you're talking about genomics, new drugs, and all these things in the world. the question that comes to me is, how does this include the people or exclude people? How does this bridge the wealth gap in the world, or does it increase marginalization in the world, create super communities and exclude a vast number of communities? How do people in the remote part of Africa access the kind of health system that you're talking about, the kind of drugs and technologies that you're talking about, the surgical system that you're talking about? How does the word inclusivity really apply practically across the world and ensure that everybody else is brought up into the picture? Thank you.
Yeah, it's a great question. Because we can have all the highest level innovation in technology and science, but if, frankly, that local care provider, that nurse, that physician can't ultimately provide that touch or the right medicine at that right moment in environments around the world, then we're not really fulfilling our mission. And one of the things that we try to keep in mind is that technology has to be done up and down the food chain, I might say, in healthcare. So I mentioned some of the things that you had also talked about, AI and ML, but something as simple, and I was in South Africa a little over a month ago in our HIV clinics, where we're actually doing some testing for an HIV vaccine. And what we found is, how can you provide something like a mobile phone with simple messaging and texting to mothers in some of those communities that can make a massive difference on transmission, for example, of HIV, to help educate them and better transmit some of that information. Now, that's a different kind of application of technology than we would have thought about, but those are the kind of things that we are taking into consideration to say, where can we make a difference? And whether it's in a developing country, whether it's in a developed country, and nonetheless using technology in the right, appropriate way to ultimately help patients. So that's one example.
Thank you. That's fascinating, and thank you so much for your time, Alex. Unfortunately, we're out of time.
Thank you very much, Erica.
But great to see you.
Appreciate it, everybody. Thank you.